Good afternoon, everyone. We're going to give attendees maybe another minute or two to join in before we actually get started. But again, thank you all for joining us for this training session. But we'll give everyone another minute or two to join in. Okay, good afternoon again, everyone. Hopefully you all can hear me and see the screen that I'm sharing with you all. Okay, we got a confirmation from Megan, so I think we're all good today. So my name is Sean Anderson. I'm one of the field service reps for the Office of Vital Records, and I'll be conducting your training for this afternoon. As you can see on the screen, we'll be covering the new fully electronic birth registration system, and we're going to talk about a few things that's going on with the system and how it's going to affect birth registration moving forward. So with that said, we will move forward. So on our agenda for today, we're going to talk about the fully electronic system and what requirements are needed in order to file a certificate electronically. We're going to talk about the fully electronic process. Now, what is the process and the steps that you will have to take in order to submit a birth certificate fully electronically? And then what about drop to paper cases or printing a certificate? Can that still be done and is that still acceptable? So we're going to talk about the drop to paper process. Then we're going to look at the new system, a demonstration. So we're going to walk through on how to register a birth in the new system and also how to uh, certify that birth before submitting it to the Office of Vital Records. So we're going to go over the new system, what's new about it, how does it work. Um, yep, so for the fully electronic system, you're still going to access it through VVES, so nothing is changing there. So VVES is the Virginia Vital Events and Screening Tracking System, which will house the new birth registration module. So you will log into VVES as you do now for registering births. The login screen will look a little bit different once the system becomes live. So we'll talk about that in a second. So VVES, it is web-based. Again, so there's no additional software needed to access the system. Again, it can be accessed the same way you do now. And the system is still user role based. So certain users have certain roles in the system to perform their duties. So you're going to still log in with the same username and password for the system. Now, the go live date is going to be Monday, August 18th at 10 p.m. So VVES will go down for maintenance at 6 p.m. on August 18th. And it is scheduled to be back up again at 10 p.m. So again, with any software launch, you may want to give it a little bit of time and may not want to log in exactly at 10 p.m. But that's the scheduled time for the system to be up and running again. So this will go live on August 18th. And this will be the new login screen for when you log into VVES. So it's slightly different than what it is now. Okay, so what is required to submit a certificate for electronic submission? And so the system right now, we're in two phases. So right now we're in phase one for the fully electronic process. And in phase one, oops, let me go back. Okay, so phase one is going to cover we're going to talk about what can be submitted fully electronically. And so what's required to do so is first the mother has to be single or unmarried for her child's birth certificate to be submitted fully electronically. So there can be no acknowledgement of paternity form completed. In your case, no paper application for the birth certificate. So if the mother decides that she wants to pay for a birth certificate at the time of birth registration, she cannot, if she decides to pay with a check or money order, that certificate will not be eligible for electronic submission. So again, the mother must be single or unmarried, no acknowledgement of paternity form completed, and no payment by check or money order for a copy of the birth certificate. So in this case, the certificate will be eligible for fully electronic submission. So that means no paperwork is going to be mailed to the Office of Vital Records. Secondly, the group that is eligible is for married couples. So if the mother is married, whether same sex or opposite sex, and no application for a birth certificate, whether the check or money order. So as long as the mother is married, either same sex or opposite sex, and there's no payment to be submitted to the Office of Vital Records physically, so no check or money order, that birth certificate will be eligible for electronic submission. And so this is going to be a part of phase one. Phase two, which is still being worked on and still being planned out, that will allow for the submission of certificates and the acknowledgement of paternity form to be done electronically. So that's going to be a little ways down the road, but for right now, we're in phase one, or phase one will be launching, I should say. And these are the situations where the birth certificate can be submitted fully electronically. Okay, so how are you going to capture the signatures? Because right now you print off the certificate and you capture the signatures physically. Well, you'll need to be able to capture signatures electronically. And you can do so on a tablet or an iPad as long as it's internet capable with the ability to sign. You can sign with the stylus. Some you can sign with the finger on a tablet or an iPad. That will be acceptable. So you don't need to download any special software, but you would need a compatible browser. So it will work with Chrome, Edge, and Safari. And Safari is the native browser for Apple iPads. So you can capture signatures electronically on a tablet or pad. Secondly, you can capture signatures using a signature pad. So an independent signature pad connected to your mobile setup. So whether it's a PC or a laptop, you can use that to capture signatures. So the signature pads that are acceptable are Evolus and Topaz branded signature pads. So if you decide to go with those, it would have to be Evolus or Topaz. And software is needed to work with the signature pad. So software would have to be downloaded to your PC or laptop for that particular brand in order to work with the electronic signing. And you can use either of these methods, or you can use both. If you have a tablet and you have a signature pad, you can decide on which method you want to capture a parent's signature. But these will be the methods you can use to capture a signature. You may also, the signatures can be captured if you're using like a mouse connected to a PC. It won't be as elegant as using a signature pad or tablet, but that is also a possibility of using your mouse as an input to draw a signature. But these will be the methods for capturing the signature. So when you capture those signatures electronically, that certificate will be eligible for electronic submission. So what is this flow going to look like for the new electronic system? Where you're still going to have the mother complete the worksheet. That's going to be completed by the parent. As a birth registrar, you would input that data into the EBC system the same way you're doing now. That's the electronic birth certificate. You're going to input the data. Then you're going to capture signatures electronically. So you're going to capture the signature for the Social Security request and the signature for the informant. So both of those will be captured electronically. Then you need to submit the birth certificate for birth certification. Now, for you all as midwives, some of you may serve as a birth registrar and birth certifier. Now, you would need to have both roles within the system. So you would need to have the role of birth registrar and birth certifier. If you have not received the forms needed for this role, Darlene sent the email out for you all for that access. If you did not get that email or you don't have those forms to request the birth certifier role, let us know in the chat and we can make sure that you get that role added to your profile. So if you're serving as birth registrar and you're also signing the birth certificate, so the birth certifier is the person that signs the birth certificate on line 22. That is the person that is certifying the facts of that birth. Once it is certified, the birth certifier will then submit to the Office of Vital Records that certificate electronically. So again, there's nothing that's going to be printed and mailed to the Office of Vital Records. The parent signature will be captured electronically as well as the birth certifier. And the birth certifier signature will be by a PIN number. And when you log in as a birth certifier for the first time, you should be asked to set up a PIN for yourself. So your PIN will be a 6-character PIN, either all letters or all numbers. And this PIN will only be known to the birth certifier, and that will serve as your electronic signature. So this is the process for the fully electronic birth certificate. So what about paper certificate? So what if I don't have a tablet or a signature pad, or what if my signature pad is broken or my tablet isn't working? Can we still submit it by paper? Yes, you can. So there's some certificates that are only going to be submitted by paper. So if the parents are signing paternity, or you are accepting a check or money order, that's automatically going to be a drop to paper submission. But if there's something going on with the tablet or your signature pad, or for some other reason you're unable to capture the electronic signature, you can still drop that certificate to paper and mail it in as you are currently doing. So the drop to paper process is the same. So you have the parents complete the worksheet for the birth certificate. That data is then entered into the EBC. You're going to print that certificate of live birth, and then you're going to capture those or obtain those physical signatures of the informant and the birth certifier. So again, the birth certifier is the individual that's signing on line 22, attesting to the facts of birth. And then you're going to mail that information to the Office of Vital Records, along with any other documentation, such as your transmittal report and an AOP, if applicable. So again, this process will still be available, as well as the fully electronic process. But as we mentioned to our group before, about 70 to 75% of birth certificates being filed in Virginia will be eligible for fully electronic filing. So we file about anywhere between 94,000 births per year, and the majority of those will be eligible for fully electronic filing. So we have a question from Megan. For births where the mother is married, but husband is not the biological parent, will this be a paper submission, or can they still do it electronically? Yeah, so as long as the mother is married, it can be submitted electronically. As long as she is not requesting a certificate and submitting payment by check or money order. So yes, that certificate will be eligible for electronic filing. Good question. Thank you. Okay, so again, so both of these processes will work in tandem. You can do fully electronic, or you can still do drop to paper certificate. Okay, so before we go into the demonstration, because the system will look differently, has a new coat of paint on it, and it's going to look a little refreshed. So some of you may be excited, some of you may be scared, but we're going to walk through it to make sure everything is okay. So before we do that, do we have any questions about what qualifies as fully electronic or drop to paper? Or do we have any questions about how the electronic signatures are going to be captured? Okay, so I don't see any questions right now, but if you have any questions as we go through the demo, feel free to put it in the chat, or if you need to come off mute and you need to verbally express your question because sometimes questions can be a little complicated. So if you need to come off mute, you can do that as well. So let us end the sharing here, and I'm going to find our screen. Okay, and I want to share it with everyone. Okay, so hopefully everyone can see the login screen for VVest. And as you can already see, it looks a little bit different than if you had logged in already today. So this would again take place on Monday, this visual new look. So again, as I said, your username, password is all going to be the same. That's not going to change. And you're still going to log in through the same URL. So let's go ahead and we're logging into our development application. So I'm going to use one of our test accounts here to log in. And you still have to make sure you check this pesky box here that you agree to the VVest terms of use. And sign in. Okay. So your main screen is going to look familiar. That's, as far as I know, that's not changing right now. So you'll have your birth certificate reporting icon here. So you're going to click on that to log into birth certificate reporting. Okay, so now we come to our main screen. You can probably already tell things are looking a bit different. A little bit of different layout. You have some colors here. But you have some of the same familiar links and maybe some new ones for you. So we have our navigation menu on the left. We have a dashboard. We have a pending list. Your advanced search, where you can search by mother or child or father. We have our mother link here, where you would begin your search for the mother. You have your fully electronic submission and your paper submission here. And you have your reporting links down below and your link back to the main menu. So these links are on your navigational menu. The same links are also represented through these icons. So they correspond to the same links here. So if I needed to go to the advanced search, I can click here, or I can just click on the icon to get where I need to go. Also on your screen, there's a little menu button here at the top, right beside birth certificate reporting. If you need more screen real estate, you can collapse this, your navigation menu, and just click it again to reopen it. So that's a little tip there if you need more real estate on your screen. So as with birth certificate reporting now, we always start with the search. We do a search for the mother to see if she is already registered in the database with the previous pregnancy. So we can begin that either by clicking on the icon here for the mother, or we can click on our navigation menu. And if the menu has a little arrow beside it, that means that list is, you can open it up. So if I click on the arrow, it'll open up my search link here. So let's do that. I'll click on search, and it'll take me to the mother parent search. And so let me close our menu here. And so we have our fields to do a search for the mother. So first name, middle name, last maiden name, date of birth, and our PIN number. And so we're going to start here with the search, and let's go with, let's see, go with Keisha and Thompson. And her maiden name is We'll say Jones. And so we want to select the date of birth, and you have your date selector here, by which you can choose a date of birth. You can type it in, or you can choose from the box here, so you can check which month. You can also go through and select the proper year, or you can navigate with these arrows to different months, and that'll keep you in the same year. But we can also type in a date. So we're going to say she was born on March 21st, 1999. And we're going to select our PIN. So you should be looking for the social security number first, if the mother has a PIN type. And then we're going to enter that social. And as you're doing your search, the more information you put in, the more narrow your search is going to be. So the system is going to look exclusively for this information. The less information you put in will broaden your search. So if you put in just her first name and last name, that's going to pull every record matching the first and last name, regardless of date of birth or regardless of social. So again, the more information you put in, the more narrow your search is going to be. The less information you put in, the more broad your search is going to be. So we put in specific information. So the system is looking for this mother by this name with this date of birth and this social. So we're going to hit our search button. And it lets us know in the search results, no results found. So this mother currently does not exist in the current database. If there was a match, we will see her listed below here, with an icon to go in and edit and start a new pregnancy based off of that existing information. But she doesn't exist currently in the database. So we have a new registration button here on the same page. And so we want to click that to start a new registration for this mother. Okay. And so from our search, it auto populates the fields from our search, so we don't have to re-enter that information again. And we do need to complete the rest of the information. And so the fields with a red flag in the corner, those fields are required. So if you see that field with the red tick or red flag, those will be required fields. So let's complete the rest of this mother's information. So her name, date of birth, social has come over. So we can select race here from our drop-down list, and we can scroll to see what we want to pick. If the mother did not identify by any of these choices, we can always do other specify, but if you do other specify, specify race 1 will be required. And there's also a specify race 2 if necessary, but that will be a requirement. So we're going to go back and select white. Then we have our Hispanic origin. Again, this is the same menu items that we currently have in the system, and we can choose the proper Hispanic origin here. If we choose other Hispanic origin is required, and the system will give us an alert to that. So I'm going to leave it blank for right now. And so when we go to save the record, we should get a notification that we need to complete this field. So next is the birthplace of the mother. So we have birth state or birth country. And so under birth state, we have our drop down here, which includes U.S. states and U.S. territories. So we can always scroll through this list. So we have our Virgin Islands here, Puerto Rico. They fall under U.S. state or birth state. Then we have our birth country, which lists all our different countries here. And you can only choose one. So we're going to say she's born in Virginia. And down below, we have a new field that we've added for proof of birth. So sometimes the mother's current name is different from her maiden name in terms of maybe the mother gets married and she moves her maiden last name to her middle name. And if you've been doing this for enough time, you know that has caused some issues when it comes to printing off the proof of birth letter, because sometimes it won't give you the name in the proper order. So if the mother's current name is different from above, we can type that here. So let's say the mother, uh, her maiden name is Keisha Ann Jones, but her current name now is Keisha Jones Thompson. And that needs to be printed on the proof of birth letter. So we can type that in. And so this name will now appear on the proof of birth letter for that mother. So you don't have to do any special manipulations trying to get that to print out right. It'll be printed based off of this box here. Then below that, we have our additional races. So in the current system, these are on different screens, but now it's on the same screen for the mother. So if there are any additional race choices for the mother, you can choose all that apply, or you can choose none. Okay, so I think we have completed everything, and I'm going to save our entry. And there we go. Lets us know that our other Hispanic origin must have some value because we left it blank. That's if we choose Hispanic origin as other. So we're going to change that to non-Hispanic and save it. And I believe we should be good to go. All right, so let us know changes saved successfully. Now, to enter new pregnancy information, you want to scroll down to the bottom of the screen. Beneath the audit information, there's a new button here that says New Pregnancy under Pregnancy Details. If the mother had previous pregnancies, they will be listed under here too. But again, this is the first entry for this mother, so there's no other pregnancy details. So we want to start a new one. So we're going to click on New Pregnancy. Okay. And this takes us to the pregnancy information screen. And if you notice at the top, there's now different tabs to move to different information sections. So you don't have to click next and next and next to go through each section. You can click on different tabs. Oops, sorry. You can go to different tabs. Once you've saved a screen, you can just click to the next tab in order to complete that information. So the tab that you're currently working on, that's going to be highlighted here in blue to let you know this is the information or this is the tab that you are currently working on. Okay. Rebecca has a question. She says, too complicated to type. May I ask it verbally? Yes, you may.
Okay, can you hear me?
I can hear you.
Okay, so back to the other name, because I actually right now have a mom whose maiden name is now her middle name, like the example
Right.
you gave.
Yes.
But the way you explained it doesn't make sense to me.
Okay.
So that's what I have a question about. If
Okay.
so, up under, because what you said under proof of birth, where her maiden name is now her middle name,
Yes.
that's what I would think I would already be putting. Like if that's her current married name, where her maiden name is her middle name. Sorry if this is not making sense.
Okay.
I think I would already be putting that up in the main information if that's her current middle name.
Right.
So
If you do
down
this,
below, wouldn't
mhm,
that be what her birth name was as
no,
the second option?
no. This will be her current name.
Why wouldn't I be putting her current name up in the mother information, like in the
Right, because if the mother moves her maiden name to her middle name, so if I put Jones here,
uh-huh.
the proof of birth letter is going to say Keisha Jones. It's going to say Keisha Jones Jones. Well, no, I'm sorry. It's going to say. Let me do this right. It's going to. Yes, I think that's right. Yeah, it's going to repeat the name because it's in these two places.
Okay.
So to avoid that, so the certificate will print out right, her name on the certificate of live birth, but the proof of birth letter is going to duplicate that name.
Oh, because it separates it out on the
Yes,
printout into her current name and her maiden name.
correct.
I see.
You got it. You got it.
Okay, thank you.
Okay. Now I forgot what I had as the middle name. And okay, there we go. And I'm gonna go ahead and resave that again. Okay. So the birth certificate is gonna say Keisha Ann Jones, and the proof of birth letter is gonna say Keisha Jones Thompson. Okay. So now we're back to our pregnancy information. So these fields are the same, but again, they just look a little bit different. So we're going to indicate, was the mother married at the time of birth or 10 months preceding the birth? And for this case, we want to do a fully electronic record. So I'm going to say, yes, the mother was married. And if we do that, we need to indicate the type of marriage. So we have opposite sex and same sex. So let's say opposite sex marriage. Our paternity option is inactive because we've indicated that the mother is married. And I think we should all know that if the mother is married or was married 10 months preceding the birth, that she cannot complete an acknowledgement of paternity. We've modified this question a bit so it can make a little bit more sense for you all. So this question was mother parent one legally married, however, not to biological father, or mother refused. So if the biological father is someone other than a spouse, or if the mother refuses to provide that information, you would check yes here. And when we check yes, that is going to have the father's information state as unknown if she was legally married or refused. But in this case, we're going to leave it as no. Then we have our birth type plurality. So we've modified this list a little bit. So it's in order now. So we have single, twins, triplets, quadruplets, etc. So now it's in the proper order. And we'll say single. This is a single birth. And we're going to enter the mother's medical record if there is a medical record number. Then we're going to enter the month the prenatal care began. If the mother did not have prenatal care, you'll put 0. And that's going to gray out the number of prenatal visits, and it's going to gray out the source of prenatal care. And so that's the way the current system operates. But if the mother did receive prenatal care, we're going to indicate the month the prenatal care began, her total number of prenatal visits, and then the source of the prenatal care. So if she received care from a private physician, yes or no. From a health department, yes or no. And was there some other source? We'll say yes or no. Then the main payment source for this delivery. We have some test options in here, but we'll say self-pay right now. Then the date of last menses, we want to enter that. Okay. And if for some reason that information is unknown, for date boxes, we now have an unknown box. In the current system, if there was an unknown date, you will put in 01/01/1850. but now that's being replaced by the unknown checkbox. So that is there if for some reason particular data is unknown to you all and you all can't obtain it. You can certainly check the unknown checkbox. But we do have this information here for this mother. And was she a smoker in the past 12 months? Yes or no? If we say yes, we need to complete 3 months prior to pregnancy or cigarette smoking, 3 months, first 3 months of pregnancy, and second 3 months of pregnancy, and third trimester. So we're going to say no, and that grays out our fields for us. We have alcoholic drinks per week. The informant relationship, so who is providing the information, we'll say mother. And we did add a new role of birth registrar. So if the mother is not going to sign the certificate, the informant can be listed as the birth registrar, but we're going to go ahead and go with mother. Then we're going to capture the mother's highest education level completed. We have our different grade options, education levels, and we have an unknown here. So we'll say 3 years of college, and we need to do the same thing for father parent too. Okay. The next two fields are about the mother being transferred. So if the mother was transferred from another facility to you, or if the mother was transferred from another state to you, these fields will be applicable. If not, these fields can be left blank. And this is for transferring due to maternal, medical, or fetal complications. Then we're going to capture the first date of prenatal visit. Did mother or mother parent one receive WIC food, women, infants, and children? So we're going to say no. We're going to capture the pre-pregnancy weight and the weight at delivery. And you can just tab throughout these fields, or you can just click in them to move from field to field. And so this should populate our weight gain for us as 21. And we're going to put in the mother's height in feet and inches. And I think we have everything there. And the system works the same way with the weight gain and the pre-pregnancy weight and the weight at delivery. If the system thinks that the weight gained is too high or too low, the system will give you a warning. So if I put 101 instead of 201, it'll give me a negative 75 weight gain. So that's weight loss. And when I go to save it, it'll let me know to check the weight gained. It is reflecting as a weight loss during this pregnancy. Now, sometimes there is a weight loss, which is acceptable. We would just need to check here and submit to confirm that that is correct. But if it's incorrect, we're going to go ahead and cancel that, and then we can fix the weight at delivery. Oops, so we need to put in the oh, I clicked that box by mistake. Okay, there we go. And I think we are ready to save. So we have two buttons at the top. We have a save and then save and continue. So we save, it's going to save our progress and keep us on the same page. If we do save and continue, barring that everything is correct, it's going to save our progress and move us on to the next page, which is the address. But right now, we're just going to save to keep us on the same page and lets us know our changes have been successfully. And we can just tab over to the address to input the mother's residence information. And so now the residence and the mailing address is on the same page. So we can input each of these separately. So We need to input the mother's residence address. If there was a previous entry or previous address for the mother, we would be able to select it. But we don't have a previous entry for her, so we're going to go with new address. And in our slide out menu is where we're going to enter the address information. So the first question is this a foreign address? Yes or no? No is already defaulted to be a domestic address, but if it is a foreign address, you can always select yes and enter that information in. But we're going to say no, it's a domestic address. So we need to put in the house number. There's a pre-direction drop down. We want to put in the street name. So she lives on 1005 Lazy Green, and we're going to say Lazy Green Avenue. So in our list here, we can choose our suffix, street suffix. We're just going to say Avenue. We have our post direction drop down if necessary. We have our apartment address, so that can be apartment number. So that can be inputted if there is an apartment number, and then the zip code for the mother. So there is an initial list here, but we can type in specifically our zip code, and it will bring up a match for us. Well, actually, I want to go with, let's see, 23218. That's still a Richmond address. So it brings up city Richmond and also shows county as Richmond. So the state populates, city populates based off the zip code. If for some reason the mother's home county is different from her postal county, because this information is pulled from the postal office based on the zip code. But if for some reason her county is different, her home county is different from the postal county, you would put that here. So if I drop down my list, I can search for a county here, or I can do a search by typing in the county name and select it. So whatever in the county, the home county, that's going to override what's in the postal county. So Henrico County is going to appear on the certificate instead of it being blank or having Richmond. We have our inside city limits, yes or no. So this zip code automatically defaults to yes. So we'll say that is correct, and we're going to save. So changes have been saved successfully, and we can close out of that. And then our address of what we entered is now there. And we show which user created it and what day. If we need to change it, we can go into this edit button and we can change it. So it should have been 1006. And I'm going to go ahead and save it and close out. Okay, so we have our 1006 here. Now for the mother's mailing address. So we only need to add a mailing address if it is different from the mother's residence address. So we don't need to retype the same address over again if it is the same. We only need to do it if it is different. So if the mother has a different mailing address, so it may be a different residence, or it may be something like a post office, that can be entered in. So this is letting us know we should add the mailing address if it is different from the residence address. So we have our same screen here that we just did with the residence address. If the mailing address is has a house number, we can enter that. If not, if it's just a PO box, if I can spell, okay. And we would need to put the zip code in. And is that address in city limits or not? We'll say no. And save. And we can close this out. And now we have our mailing address here. If we need to change it, we can edit it if we had the wrong number, or we can take it out altogether. So there's a disassociate address button here. So if we need to remove it, the mother doesn't want to include the mailing address, or we put it in an error, we can disassociate the address. Are we sure we want to reset it? Yes, we are. And it removes it from the list. And so we just have the mother's residence address. But let's go ahead and put this back in. And save it. Okay, so we have our address back. So on this screen, we don't need to save it again. We can just hit continue, or you can click on pregnancy statistics to move to that screen. So we're going to go to pregnancy statistics. And this screen should still look familiar. It's the same as the current system. So we have our risk factors for pregnancy. Again, you would check all that apply. We have our infections present or treated during the pregnancy. Again, check all that apply. And we have our maternal morbidity. Check all that apply. And other history, again, check all that apply. So this works the same way. We can check one, or we can check none if none are applicable. We'll say none for maternal morbidity and none for infections. And save. Okay, and we also have our save and continue to. If I had save and continue, it would have took me to father parent 2, but I can also just click on it. Okay, so now we have our father parent 2 search. So just like we did with the mother, we're going to search for father parent 2. And we did indicate it was the same, opposite sex marriage. So we're going to put Larry Dean Thompson. We'll say he was born November 16th, 1998. And we're going to put in his social. All right, and we're going to search to see if he is in the database. And no, we have in our search results, no data found. And we have our create new button. So we're going to create a new entry for this father. Okay. And just like with the mother screen, we need to complete the rest of the information. The information from our search has populated. So we're going to go, we'll say white, Hispanic origin, we'll say non-Hispanic, birth state, we'll say he's born in Connecticut. And we have the same option here for parent 2. If parent 2's current name is different from the name here, and that could be impactful if it is a same-sex marriage where there's 2 women. So the spouse's current name may be different from the name here. So we can enter that into the proof of birth letter if it is different from above. Because if it's a same-sex entry, the maiden name is going to be required. But if we don't want the maiden name to appear on the proof of birth letter, if it's different, if the current name is different, we can put that here in the proof of birth boxes. But for right now, this is the current name. There's no difference, so we're going to leave it as it is. And we have our additional races options, and you can check as many as apply. And we're going to hit save. Okay, lets us know our changes have been saved successfully. If you are doing a paternity, you want to make sure that you just save on this screen, on the father screen, and don't go to the next screen yet. Because if you're doing a paternity, at the end of the screen at the bottom, there will be a new section for the father's address. So whenever you're doing a paternity, the system will require that you capture the father's address as well. But since we're saying that they are married, there's no option here to capture the father's address separately. But if you were doing paternity, you would just hit save on this screen, scroll down to the bottom, and then enter the father's address. All right. And we may be able to do that if we have time to do a drop to paper. Okay. Yes, and even if the father's address is the same as the mother's address for paternity, you still need to enter that into the system. Okay, so now we want to, let me see, let's save it again. Okay. I don't think I made any changes, but okay, we'll do children's stillbirth. So this is where we can now enter the birth record. Some individuals have access for also fetal death registration. So those are for experiences where the child died before delivery. Some individuals can do a fetal death entry. But for this case, we're doing a live birth registration. So we want to select the new child button. And that's going to take us to our child details, child information screen. Again, so our information here is going to be the same as in the current system for the most part. It highlights which page I'm on, and it defaults to the facility you've logged into. If the child was born in a different location than your facility, so if the birth occurred at the mother's home, you can select other place of birth. And we have our home unknown if intended, home intended, home not intended. So we'll say home intended. Okay, so now we want to put in the child's information, so the child's name. Okay, we're going to say there's no suffix. We're going to put in the date of birth as today and time of birth. So 10:23. Then we have our formatting AM, PM, military time. So we'll say AM. Gender, we have male. Birth order automatically populates to 1. And this is a single birth. So that automatically populates to 1 for us. If you were entering twins, when you go to enter the second twin, it should automatically populate as 2. When you're entering the second twin and it doesn't populate as 2, that would mean you've entered a new pregnancy instead of connecting it to the previous entry for that mother. So you do want to be careful of the birth order. Then we're going to enter in the weight in grams, and that's going to calculate the pounds and ounces for us. The now living box, that refers to any previous live births this mother had where the child is still living. So if the mother had one previous child before this birth and that child is still living, we're going to put 1. And if we do that, we do need to put in a date of last live birth. So we're going to say she last had a baby July 5th, 2023. This box for now dead, meaning does she have any previous live births where that child is no longer living? So we're going to say, we said that she only had one previous live birth, that child is living. So now dead is going to be 0. number of terminations. So that include spontaneous fetal deaths and induced terminations of pregnancy. We're going to calculate the total number of both of those. But if the mother didn't have any previous terminations of pregnancy, we're going to hit 0. If she did, we would need to enter in the date of last termination. I'm sorry. The estimated gestation, we'll say 39 weeks. We're going to enter our APGAR score information for this registration, and we'll say this baby is alive and well. So we'll say 9 for 1 minute, 9 for 5 minutes. And if there's no APGAR score taken at 10 minutes, you would just enter in 88 for not applicable. So we don't want to do unknown, but we want to put it in as 88 as not applicable. Then child's medical record number. If for some reason the child was born alive but unfortunately passed, we would need to indicate the date of death for that infant. Okay, let's see. Are the parents requesting a social security number? Yes or no? And again, this is voluntary. The parents do not have to request a social, but if they do need to sign for that. And in this case, they'll be signing electronically. Mother and father parent 2 ages are automatically calculated for us. Was this infant transferred in 24 hours? So was the infant transferred to a different facility? If no, you would just indicate no. If the infant did have to be transferred to a hospital, we can choose the hospital, or we can transfer, if the child was transferred to a different state, we would indicate the state. But again, if the child was not transferred, we would just leave these blank. Is infant being breastfed? We'll say yes. Is the baby for adoption? Yes or no? We'll say no. Is this a surrogacy? We're going to say no here. So we're asking, is that mother a surrogate mother? We're going to say no. Is this a foundling? So a foundling is an infant of unknown parentage. Now this, I believe, is a requirement of hospitals that they have to record a foundling, but I don't believe that's the case for midwiferys. But we still have this question in our child screen here. So we'll say no, this child is not a foundling. Then there's a box for NDBS device IDs, and we'll leave that blank. So we filled out all of our top portion here. We've separated the certificate request and contact information. So if the mother wants to request a certified copy of the birth certificate during birth registration, we have our yes or no options here. So if she says no, she doesn't want to request her certificate, you can just leave your information blank, the rest of the contact information. But if she does want a certificate to be mailed out to her, she can select yes. Then we have our payment type. So check or money order or online. Remember, if check or money order is selected, this record will no longer be eligible for electronic submission. So even though the parents are married, if it is a check or money order for the payment type, it will not be eligible for electronic submission. So if we do online, it will be eligible because there's nothing being mailed to the Office of Vital Records. Then we're going to capture the mother's telephone numbers. So we only captured 10-digit US numbers. And does the mother want to receive text messages about her request? Yes or no? If there is an online payment request, the mother's email address is required. So you want to make sure that you capture that email address and you want to verify it with the mother that that is the correct email address. Okay. So input the email twice. And then you need to choose who the medical attendant was for this birth. So you can choose from a list of already of previous entries that are available, or you can enter a new medical attendant. So we're going to choose from our list, and we have some already pre-populated from our test database. So we're going to choose D. Fisk here, and that populates for us. So we looks like we have all of our information completed. Now, if this was a surrogacy case where the mother was a surrogate, the system will not allow you to request a certificate. So if I go to save this, I should get at least one notification or one error message. So yeah, it lets me know a certified birth certificate cannot be requested for surrogacy. So if the mother is a surrogate, she cannot request a certified copy of the birth certificate. So we're going to go ahead and say no. Okay, now we want to go ahead and save. Okay, and our message lets us know that this birth record is eligible for electronic filing. So again, the mother is married, and there's no check or money order application payment for application being submitted to our record to our office. So this record can be submitted electronically. So we did say that the child was born at home. So we're going to click on other place of birth address. And so we have a choice here. I don't think the child can be born at a P.O. box address, but we have that because that's a saved address for the mother. And we also have uh, this address here. So I believe this was the mother's address, Lazy Green Avenue. So we want to select that as the address. If it happened to be a different residential address of where the birth occurred, the birth may occurred at the grandmother's house or the sister's house or a friend's house. We can enter in the address of where the home birth occurred. So home just really means the residential address. And so we're going to click submit. All right, so we have our other place of birth address. And now we want to move on to our birth statistics. So we can hit continue or we can just click on birth statistics. And now we're on our statistics screen, and this is going to be the same as the current system is. We have our characteristics of labor and delivery, um, obstetric procedures, and method of delivery. So under characteristics of labor, we're just going to say none here. We'll say none also for obstetric procedures. Under method of delivery, we need to select our fetal presentation at birth, and then the final route and method of delivery. So once we have that, we can go ahead and click save or save and continue. So I think I have everything here. So I'm going to hit save and continue this time. And it should take us to birth statistics part 2. And it does. Okay, so now we can put in our congenital anomalies or the conditions of the newborn. And we'll say none for both of these. Okay. And we'll go ahead and hit save and continue again. And that should take us to the child SSN address. Okay. All right. So if we want to, if the mother wants the social security card sent to a address other than her residence address, we need to indicate that. So we already did save a P.O. box address or the mailing address. So if the mother wants the social security card submitted to the P.O. box address, we can select that. If she wants it sent to a different address, we can create a new address entry here. But we're going to say she wants it sent to her P.O. box. And we're going to hit submit. Okay, so now we have our address as to where the Social Security card is being mailed. So we want to verify to make sure that that is correct. So now when we scroll down, we need to capture the signature for the SSN request. So currently you capture that directly on the certificate of live birth. When you print it out, you have the mother sign at the bottom and date it, or mother or father sign and date it. So the system asks, how do you want to capture the signature for the SSN request? So we have two options, electronic and paper. Electronic will give me the option to now collect an electronic signature. If I choose paper, the system will then convert this to a drop to paper certificate because we can't submit it electronically if we're capturing a physical signature. So this can be used in those instances where, let's say you're not ready yet by Monday or by Tuesday to capture electronic signatures. You don't have your tablet yet, or there may be something going on with it. You don't have a signature pad, or you just say, "Hey, I don't want to submit it electronically." You can drop the signature, you can drop the certificate to paper, but you would have to select the paper signature option. So you can still drop these certificates to paper for physical signatures. But in this case, we want to do electronic signature. So at this point in time of birth registration, it depends on how you are doing your data entry. So if you are starting on a PC or a desktop computer, you would then pull out your tablet. You can then log into VVest on your browser on your tablet, search for the mother or child, and then you can navigate to the child SSN address, and you can come to this page to start the capturing of the electronic signature. Or you may want to do it all on your tablet. You can do all the data entry on your tablet and capture the signatures on your tablet. You would just probably need a Bluetooth keyboard or mouse for your data entry. But you can technically do it all on a tablet when it comes to the data entry and capturing signatures. So that particular workflow is going to be determined by your midwifery on how you're going to do this. You can do both options, or you can do one or the other. It's going to be up to you as to how you decide to capture the signature and how you do your data entry. So at this point, we're going to capture the signature electronically. And there's a button here to say, which says add electronic signature. So we want to click on this. And it's going to pull up a certificate for us. So this certificate here is a preview. So if you're pulling this up on a tablet, parents can zoom in and zoom out to make sure that everything is perfectly okay. Or you can show this if you're doing everything on a laptop, you can show them this screen here to verify that the information is correct. So they can scroll and see the information. And we need to indicate who is providing the signature for the social. Is it going to be the mother or father parent two? If the mother is the informant, we suggest that the mother also be the one signing for the social. But we're going to say the mother's going to sign for the social. Then you need to indicate how you're going to capture that signature. Sign here. This needs to be indicated if you're using a tablet device. So a tablet or iPad, you're going to just leave it as sign here. And you're going to give the stylus to the mother. And in the box, she can then input her signature. If you are using a signature pad, so an independent signature pad attached or connected to your PC, you need to decide which brand you're using, so Evolus or Topaz. And the system will let you know. So if I choose Evolus, the system lets me know that my tablet is not connected to my PC. So my software is downloaded, but my tablet is not connected. So I'm going to go ahead and connect that now. And I'm going to refresh. And I think I may need to click that again. Yep. So now I have my tablet, my signature pad next to me. And I'm going to put something there, something like a signature. So that captures it there. So if you're using a signature pad, you just need to verify in the box to make sure that it has captured the full signature. Then whoever is signing needs to acknowledge that they are requesting a social security number for my child. And again, this can only be signed by the mother or father if they're married. And lets them know that the Office of Vital Records will notify Social Security. They should give it about 6 to 8 weeks before they receive their Social Security number. And if they haven't received one, they need to contact their local Social Security office. If our signature, we don't think it was good enough, we can clear out our signature and input it again. So let's see if I can do that again. All right. And make sure my box is checked. And we want to submit. We don't want to leave the site, but okay. So now when I scroll down to the bottom, we see a preview of the signature here. Indicated signed by the mother, the date, and the time that it was signed. Okay, Degra, you said, can we sign with the finger on the mouse pad on a computer? Possibly. It depends on how good your mouse pad is. Some are better than others. You can certainly try it. You can also sign with a mouse. If you have a mouse connected, like I said, it won't be as elegant as using a stylus, but that's another way to capture a signature. So yeah, it may depend on how sensitive your mouse pad is on your PC, if you want to do that. So let me see. Let me try it on mine. I don't think I've tested that yet. So let's see. So if I want to edit this, and let's see, we're going to say mother. And let's see if this works. No. Yeah, so on the mouse pad, it isn't doing anything. It's just moving the cursor. So I don't think that's going to work. In terms of brand of stylus, we don't have a recommendation. Um, yeah, pretty much any stylus should work for your PC. It's going to be for your tablet. Rebecca says if you're using a stylus, it should be the one that came with your tablet or a signature pad. Most likely. I know with iPads, you have to purchase well, they have the Apple Pencil, which can be expensive. But there are other compatible styluses that work with an iPad. So you can probably look on Amazon or look on the Apple website. I think they have some alternatives to the Apple Pencil that'll work just fine. Yeah, and if you're using a signature pad that's connected, usually they do come with a little stylus to write on. I'm sure there are probably some alternatives or backups that you can buy for that'll work on the signature pad as well. Hmm. All right, gonna submit. Okay, so it updated our signature. So we're good there with the social. Now we want to capture the informant signature. So currently on the certificate, this is where the mother signs on line 21. So we had indicated that the mother was the informant. So we want to capture her signature electronic. If you do paper, if you select paper, you're going to get a pop-up because we've already done the social electronically. So if we do the social electronically, we also have to do the informant signature electronically. So let's cancel that. So we're going to choose electronic and add electronic signature. And we have our preview again. And we can preview everything is correct. How do we want to capture the signature? So it's already been identified that the mother is going to sign, so we don't have that option. Sign here if you're using a tablet with a stylus or a tablet with your finger, or check here if you're using an Evola signature pad or Topaz signature pad. Okay. That one not so good, but we'll go with it. And then the informant also needs to check here that by signing this electronic preview certificate, I am certifying to the best of my knowledge the information provided is true and correct. So it gives the code section for providing or supplying false information. That's a class 4 felony. And once the birth certificate has been filed with the Virginia Department of Health Office of Vital Records, any corrections or amendments must be submitted to the state registrar. So once everything is submitted to us, that's going to be it. Um, the record would then have to be amended or corrected. So we're going to go ahead and submit our signature for the informant. And we have our preview there. And we're almost done. So the last thing we need to do is to submit the online application because we indicated the mother wants to do an online application. You may, hopefully you're already doing this for your parents, submitting the online application. So we can hit save and continue to get to the online application, or we can go into our navigation menu and click on online application. Okay, and let's see, for some reason, we only have the last name for the maiden name of the mother. So we'll have to check on that because it should show the full name, but we'll check on that. Or I think we have some of our developers on the line too, so they can check here. For the maiden name, it should show the full maiden name for us. Let's see. We have our email address, we have our residence address, we have our PO box, child information, and father's name. So we want to indicate how many copies the mother is requesting. And as far as I know, we don't have a limit on that, so the mother can pay for as how many copies that she wants. And so we need to select a reason for the request and hit submit. And so it lets us know once we submit the online application, you cannot change the request to no. So we're going to go ahead and submit. And there's a note to provide the tracking details to the mother so you can print off the tracking sheet for her. And it gives her a tracking number, her email address, phone number, and URL where she can track the status of her request or retrieve her application, I should say. We're going to close that out. Okay, so our online application for birth certificate has been submitted. You can resend the link to the mother. You can also reprint the tracking sheet for her. So at this time, we've completed everything, I believe. And we're going to go to the child detail screen. So underneath children birth or childbirth, we're going to go back to our child details page. And now this certificate is ready to be submitted for electronic filing. So if you are both serving as both birth registrar and certifier, you still need to submit it. And you'll still be able to certify the record, but you still have to submit it. So you're basically submitting it to yourself for birth certification. So birth certificates, they can be submitted individually, or they can be submitted for certification in bulk. So you can do more than one at a time. So right now we can submit one. So once submitted to the birth certifier for electronic filing, you cannot make any changes. Are you sure you want to submit? So once we submit it, it disappears from our ownership. So if we submit it, we get a preview copy of the certificate because this is just for your internal use only. So that's why that's there, because you don't need to send us a copy. We have our signatures that are captured as well. If we need to make changes, we're going to have to deactivate it. So if we realize, hey, something was wrong in the spelling of the child's name, mother's name, father's name, before it's certified, we can deactivate it and recall it back to us as a birth certifier. So I'm going to go back to the child details page, and I can make changes if need be. So Megan asks, how much time do we have to deactivate it in the system? You have up until the birth certifier certifies it. So it will remain in this pending status until it's certified by the birth certifier. Yep, you're welcome. Under our children birth list, the only thing you would need to print is your proof of birth letter to give to the mother. And so we see how on the proof of birth letter, it shows her name is Keisha Jones Thompson because that's her current name. It shows the father's name here. So that's her current name, Keisha Jones Thompson. But if we go back to our certificate, so birth certificate part 1, and you may be able to see it. Let me see if I can print it. Maybe make it a little bit larger. Her name is Keisha Ann Jones on the certificate because that's her maiden name. So that's why we have that different proof of birth letter, proof of birth field, because the mother's current name is different from her maiden name. In most cases, they want their current name to appear on the proof of birth, and it won't double the names on the proof of birth letter. All right. Um, so like I said, we can submit this individually as a birth certifier, or we can go to fully electronic filing. So if I click on our arrow and click assign to birth certifier, it'll take me to this page here. And we can search for a particular record to certify, or we can pull from our to send for certification, or we can pull from our birth list. So these that are checked, that are gray, these have already been submitted to the birth certifier or assigned for birth certification. We have two here that have not been assigned, and this is the one we just created for Ryan George Thompson. So we can select all that's available, and that will select the two for us. Or if we just want to send one for certification, we can just click on the one. But we're going to go ahead and click on both. And we're going to submit. Okay, now it's been submitted for birth certification. So if you are both a birth registrar and the birth certifier, you won't need to log out. Under your fully electronic filing, you'll have a link there for your pending list to then certify the records. But right now, I'm only logged in as a person who can enter the records. I'm not logged in as a certifier. But if you have both roles, you don't have to exit the system, or another person doesn't have to come in to certify it. You will also be able to certify that record. So I want to go ahead and submit these. Okay, I think I already did. Okay. Yep, so they're already been submitted. They're checked. So now these are ready to be certified. So certifying is certifying the facts of that birth. So what I'm going to do is I'm going to log out, and I need to log in as a certifier. And as I'm doing that, Degra has a question for Darlene. She said, I do not know if Alyssa and I are certifiers or not. Can you please tell us if we need to do that?
Well, nobody has been given the role of certifier yet, as I only sent out the forms today. So you should have, I sent out those forms in an email. So I want you all to get those forms completed and send back to me. For those midwives that don't have somebody else in the office that they don't want to assign the role of certifier to, then you will need both roles as certifier and birth registrar. So once I get those forms back in, I will be adding those roles to your account.
Yep, she got it. And Megan says she's working on the forms now.
Awesome.
What are you looking for the user ID? That is going to be the person's username. So individuals can choose their own username. So they decide on that. If they don't choose a user ID, then we'll make one for them.
Be the same ID.
Yep. So if you're already a birth registrar and you're choosing to be a birth certifier, you're going to have the same username. So you'll put down your existing username there. All right. So now I'm as the birth certifier. You're welcome. And I'm going to go into the system. So right now I'm just a birth certifier. I'm not a birth registrar. So my screen is a little bit more limited. But under fully electronic filing, You can click here, or you can click the icon here. So if I click my arrow, I'll see my pending list and completed list. So I want to click on pending list. And it'll show me the records that have been submitted for electronic filing. So I have a few more here that are ready to be submitted. This is the one that we've just created for Ryan Thompson, Ryan George Thompson. Okay. And if we want to preview that record, we can again. There's a little icon here. If you need to see another copy of the certificate for some reason, you can view the entire record. And this is, again, just for internal use only. And you can print that out if need be. If not, you don't have to. For records that need to be certified, you can select them individually, or you can select all of them at once. And when you see when I selected them, there's a button here to send back to the birth registrar. So if for some reason we need to make changes to these records, we can send back to the birth registrar ownership. And that will allow you to make changes to that record. But we're going to say we're going to submit all of these for certification. So I'm going to click on the submit button here. And as a birth certifier, I need to enter my PIN, but first I need to acknowledge that I am authorized to certify the facts of this birth. You understand it's a class 4 felony to willingly and knowingly make any false statement or supply false information. Once the birth certificate has been filed with the Office of Vital Records, corrections or amendments must be submitted to the state registrar of vital records. So I'm going to go ahead and enter my PIN and re-enter it. If for some reason you forgot your PIN number, you can reset that here. So you can click the reset PIN button, enter and re-enter your new PIN, and hit submit. But we're gonna say our PIN is correct, which it should be, and then we're ready to submit. And you have one last final notice. Are you sure you want to certify? Cannot change once submitted. So once you submit these records, that is it. You won't be able to go back in and make any changes because it's just like putting it in the mail to us. It's going to be submitted to us electronically, and that's going to be it. So I'm going to hit submit. And now my pending list is all gone because I submitted everything. I can click on my completed list. I can search for an individual record, or I can see everything here that I have submitted for electronic submission. And it will show who created the record, who certified it, and the date that it was certified for that record. And so if someone, again, if they're just a birth certifier, this is all the information that they see. And they are pretty much done at this point. So I'm going to go back and log in as the birth registrar, just so we can see a little bit more information. Okay. All right. So if I wanted to check on the status of my submission, I can go to my advanced search. And I can search for the child, or I can search by the mother or the parent for a particular record. Let's say we want to search by the child, which was Ryan George Thompson. And I want to click search. At the bottom, it gives me my advanced search results. So I can see for this child the name, gender, date of delivery, mother's name, father's name. The status is filed with OVR. So filed with OVR means that the birth certifier has signed it and it's been submitted to the Office of Vital Records. Now we haven't yet certified the birth certificate yet, meaning we haven't given it a state file number. Once we assign it a state file number, in this box, it will indicate that it is certified. You won't see the state file number, but you will see that it has been certified. So this is where you can see the status of your submission. And so right now, this is it's a very, very new process. And so it may take some time to kind of figure out the timelines as to how long it's going to take. Once the certificate has been submitted electronically to the time that it's available. But we're anticipating it's going to be a lot sooner than you having to put it into the mail. So ideally, what we would like to see is that, the day that is submitted, that it will also be processed and certified that same day or within a day or two. It all depends on which day it's submitted. So if it's submitted late on a Friday, it may not be until Monday or something like that. But yeah, we're going to work out some timelines with our group that files the certificates. So it may take a couple of weeks, may take a month or so before we can really get a feel as to how this is actually going to take place in terms of making these records available. But we anticipate it being a lot quicker than have you all having to mail those certificates to us. And this process will take care of a lot of errors, a lot of rejected certificates. Sometimes we get certificates missing signatures, or it's signed in the wrong color ink, it's printed on the wrong paper, and we have to reject it. With these electronic submissions, that's going to cut out on a lot of rejected certificates or having any reprints. Really, the only reprint should be limited. Well, hopefully we don't have any, but they should be limited just to the drop to paper certificates. You also have a dashboard for your facility. So this is a visual dashboard of what's going on. So it's showing your pending cases, drop to paper, cases that have been assigned to the birth certifier, paper records mailed to the Office of Vital Records, electronic records filed with the Office of Vital Records, how many certificates have received a state file number, meaning it's ready for issuance. And then you also have some graphical information here. If after maybe a month or so from now, you all have some ideas as to what you would like to see, some other types of information on your dashboard, make sure to let us know, or communicate with Darlene, and we can talk it over with our team to see if that's something that can be implemented. But this is your facility dashboard here. Yeah, so Darlene said they'll cut out some running to the post office to get certificates mailed to us. All right, so I know we're a little bit over time. I think we kind of underestimated how much time it would take to go through this. If you all are able to stay on, I can walk through a drop to paper certificate. If you need to go, that's understood. We're also recording this as well. So yeah, if you all want to stay on, I can walk through a drop to paper process. Okay. So I think a few people have to leave. Rebecca, Mary, Sydney. Um, we'll see how many people are still on. So we'll walk through this quickly. Okay, well, it depends on how many people are going to stick around. I think a few people are leaving us. We have Alyssa still there, Juliana, Jasmine. So if you all are good to stay and you want to see a drop to paper, just give me a thumbs up or put it in the chat. If not, we'll end it here. Just want to make sure that if you all have any questions that you all can see it. Okay, so it looks like Deborah is staying. Okay, Juliana. Okay, see you. Jasmine, good to go. Okay, so let's go ahead. So we're going to start with another search. We'll probably move to this a little bit more quickly. Uh, Taylor, last name Taylor. And PIN number. Search. Okay. No search, so we'll do a new registration. We're going to complete the rest of the mother's information. And so nothing is changing here. We're going to say her name is the same as her current name is the same as her maiden name. So we're going to leave this information blank. There's no additional races, and we're going to save. Right? Going to scroll down and start our new pregnancy. So we're going to say the mother is not married, and her and the father wants to do paternity. So this is going to make it a drop to paper case. We say this is a single delivery. Mother's number. Prenatal care begin. And number of prenatal visits. Source of prenatal care. Our main payment source. Date of last menses. The mother was not a smoker. Let's see. Okay, so Megan says that she's working on her forms for the user ID. A lot of people go with first initial and then last name, but it can be whatever you want. It just can't begin with a number. And I think it has to be shorter than 16 characters, maybe. But yeah, most people go with first initial, last name. Mother. No. Pre-pregnancy weight. Right, and save. Okay, everything is there. Go with our address. And the court. And yes, and city limits and save. Close. All right, we're going to say there's no mailing address. So we're going to do our pregnancy statistics. And we're just going to say none for these. And save and continue. All right, so we're going to put in the father's name. Of course, I had to put in a name I could barely spell. Okay. And his pen type. And search. All right, no record for him, so we want to create new. And we'll complete his information. And his name is not different, and there's no additional races, and we'll hit save. So remember again, if you're doing a paternity, you just want to click save on this page and scroll to the bottom, and you'll get you'll have to add the address for the father. So this is only when you need to do a paternity. And save and close. Okay, so we can go to children, stillbirth, and new child. Date of birth today, time of birth, 1 p.m., female, say no living, or now living is 0, now dead is 0, termination 0, estimated gestation, APGAR scores are good, child's medical record number, oops. Social Security request, yes. Child transferred, no. Infant being breastfed, yes. Baby is not for adoption. The mother is not a surrogate. This is not a foundling. We're going to say they don't want to request a certificate. Want to choose our medical certifier. And save. Okay, so now we get this message here, drop to paper. So this record must be submitted to OVR as drop to paper because of paternity or paper filing, or the certificate request was check or money order. So now this is different from what we saw before. So this is telling us that we have to drop it to paper. So we can go ahead and complete our birth statistics for the child. And save. Okay, birth statistics part 2. We're going to click none for these. Okay, and save and continue. So when we get to the social, since this is not a electronic record or eligible for electronic submission, there's no signature to be captured here. But we do need to select the address if different from the mother's address. So that's the father's address there. We're going to say, no, the Social Security card is going to be mailed to the mother's address. So we're going to leave everything as it is. And save and continue. And that's it. So we didn't do the online application. So we have our certificate that we're going to print. And we're going to capture the physical signatures for the record. So on lines 21 and line 22, you're going to get your physical signature. So signature from the informant and signature from your birth certifier. And so now on your list underneath children birth, you can click on your affidavit of paternity. And the new paternity forms will only need to be notarized on one page. The second page is going to be for instructions for completing the AOP, and then there's a rights and responsibilities page as well. Yes. And so, yes, you do need to, if you're doing a drop to paper, you still need to print it on the birth certificate paper that we provide. So the 2-hole punch paper, you're still going to need some of that for your drop to paper certificates. So the AOP will have the address of your facility there. Yes, they will. So if your notary address is different, you won't be able to produce it from the system. You would have to do a manual acknowledgement of paternity form because it is built in to pull the address of the facility. So yeah, if the notary address, if you're using a different notary address instead of the facility, you're going to have to do a manual paternity form. And then you have your proof of birth letter available to print. So you're going to print out all of your documents, and when you're ready to mail your documents, you have to drop it to paper. Again, you can do that individually. If I go to child details, I can just click drop to paper, and that'll do it individually. Or if I'm waiting to do more than one, I can go under here to paper filing and then click drop to paper. And so I have 3 records here that are available for drop to paper. And so I want to go ahead and submit those. Now, once you submit them, you won't be able to make any changes. So you have to make all your changes before you submit. So I can select all, or I can select them by individual records. So I'm going to go ahead and submit these as drop to paper and let you know you can't make any changes. And then the last step right beneath it is mail to OVR. So once you have mailed the certificates to OVR, you need to indicate that. So we have our list here of records that we're going to submit. And some have already been submitted to OVR. This is the one we just created at the top. And I'm going to do submit. So it has to be mailed, the status has to be changed to mail to OVR in order for us to assign it a state file number. So you're going to go ahead and submit, hit OK, and you are done. So all of these have been indicated with a status of mail to OVR. So now we're going to be waiting on the physical certificate to come in, just as we do now, for that record. And when you're creating records, before they're submitted to the birth certifier or before they are dropped to paper, you do have a pending list as well. So if I click on this pending list, we have certificates here that's from our testing. And you can pick on a certificate and you can see what's going on with that record. So I can see the name here. So you can look at the mother's name, or you can look at it by child's name. And if you click on your pending task, it'll let you know what's going on with the certificate. So this is a paper certificate, but it hasn't yet been indicated as mailed to OVR. So it's going to stay in your pending list until you do the mail to OVR. Um, I believe so. Well, so the system will still um, lock the record after 7 days unless it is submitted for electronic, unless it's submitted electronically or dropped to paper. Um, we have to check to see if you all can still update the statistics after that point. Um, but yeah, but once you submit it as a drop to paper or once it's submitted electronically, you won't be able to go in and make any changes to the demographic information. Again, just like sticking that birth certificate in the mail and having it sent to us. And so we will have some additional documentation for you all, some step-by-step guidelines regarding the entry of the birth record as well as the certification part of it too. And so hopefully we can get this to you within today or tomorrow. So do we have any questions on the process itself? All right, Deborah, what you got?
I just unmuted myself. Okay.
That's fine.
Mr. Sean, this is like a lot of information.
It
And
is.
I have not been able to retain it all, for sure.
Okay.
When I'm doing this and I get confused and I make mistakes, which is gonna 100% happen, can I call you guys? Like, what do I do? Like,
Nope,
I guess.
you can't call us.
Okay.
No, you know I'm playing. You can call us.
Yeah.
Well, why would you not be able to call us?
Well, I guess I'm just like thinking through this in my mind. How am I gonna do this, you know? So it's like, okay,
Hmm.
I'm gonna like do all the data entry ahead of time, and then when the mom comes in, I'm gonna like I gotta find out how she wants to pay, and then do the whole signing payment thing with her while she's there. And I guess
Hmm.
that's the part that I'm like, maybe I will get confused when I'm trying to do
Okay.
that for her, right? And she's in the office, and we have limited amount of time to
Hmm.
work on this. You know, that's what
Yep.
I'm. Is like, what number should I call when I'm confused and I have a patient with me and I have a little
Darlene
like,
Wampler.
You can call Darlene or you can call the field service number. So Darlene is 804 662 6279, and I'm gonna put that in the chat.
okay, poor Darlene.
Monday, I'm not here on Monday, so
Oh,
I'm sure Tuesday I will be inundated with calls. It's okay.
I'm sure
Or
you
you
will.
can or you can call the main field service number. So that's 804 662 6218. So that's picked up by any one of us in the field service office.
Okay.
So sometimes you might get Darlene on that number too. So we all rotate with that number.
Okay.
Yeah, so this new system doesn't mean you can't call us.
Okay, well that's good. I mostly just wanted to make sure I could get somebody on the phone if I like needed help immediately, you know,
Mm-hmm.
because I can see that happening.
Okay. Now sometimes
Okay.
it may not be 100% immediately. We may be helping somebody else at the time. So, but yeah, give us a call and leave a message.
Yes. Okay, well, I guess we'll just suffer through this together.
Yeah, we're all going through it together. It's a brand
Yeah,
new process.
Huey. Okay. Thank you.
We'll get there.
Yes. Thank you
Okay.
for all your time.
No problem. Does anybody else have any questions?
Hi, yeah, sorry, my chat's not working.
Okay,
I just want clarification on two things. Line
sure.
21 is for the mom to sign, and line 22 is for the birth attendee, like the provider that attended, would that change to the certifier, or is that still the attendant? And if so, what's the certifier signing on a paper copy?
Yeah, so the certifier can be the attendant. It doesn't have to be. Um, so I know with like some of our hospital facilities, um, the person who attends the birth isn't always the person that is certifying the facts of the birth. But it can be the same person. So the attendant can be the certifier. So the names would be the same. Now on line 21, that should be a different signature.
Yeah,
So
line 21 should be the mom. My question
right.
was, my so my midwife, she signs 22 as the birth attendant, but I'm the office staff and I would be
Uh-huh.
the certifier. So would I sign line 22, or could I sign line 22
Yep.
as the certifier?
Yes, you can. So we just need to make sure we have your forms so we can give you that role in the system. So do you already have access to VVest?
No. Oh, yes, I have access to the system. I just don't have the certifier. Which then gives me another question for your list. We would typically put our midwife because it asks for the who is there. Would we put the certifier's name instead of the midwife's name for not on the
Um,
for the list?
so you're talking about putting the certifier as the attendant name?
When you're in your system, it says select from your list. We would put our midwife on, and that's the name that shows up on line 22. But if she's not signing and I am, would I still put her name there?
No,
For
you don't have to. No.
okay,
Yeah, so remember the attendant and the certifier can be two different people. So you can still put your midwife as the attendant, and
okay,
then you can sign as the certifier.
perfect. Thank you.
Yep. Yep, no problem. Sorry about that.
No, you're okay. Those are my only questions.
Okay. Good question. Yeah, just make sure we get those forms back for you so we can add that role for you. All right. Any other questions? And as I mentioned to the group before this, hopefully you all like the changes. I'm not asking you if you love it. That's a different question, but hopefully you like it, and hopefully that will speed up, the process for the parents to get access to their children's certificates a lot sooner, especially with the fully electronic submission. Because parents are always wanting the certificates faster and faster. And theoretically, it could be available the same day um, that the record is submitted. But so hopefully this will be a good change. Again, it's going to be a learning curve for all of us, even us here at Vital Records, because again, it's a brand new kind of process and a new visual look for the system. But yeah, we're going to all work together to get this done on behalf of the families. Um, so last call for any questions, any comments. I see my boss typing in the chat, so let's see if I'm in trouble or not before we close out. And thank you all for sticking out, staying put over time. Um, yeah, we kind of underestimated how much time it would take to kind of go through this, but we'll let our other groups know tomorrow during our other training. So there will be another training tomorrow. You all don't have to attend. We're going to go through the same thing. But if you all need to review it again, you can certainly attend that training tomorrow morning. So, yes, if there is nothing else, I'm going to let you all go. And I hope you all enjoy the rest of your day.